COVID-19 left a wave of destruction in its trail. It claimed at least 6 million lives globally, caused major economic and social disruption, and pushed back decades of development gains in poor countries. The report says these costs in the study are likely to be conservative estimates of the true cost to society of COVID-19 infections in healthcare workers. It says the economic impact tends to be higher where there is already chronic shortage of healthcare workers. KwaZulu-Natal province was found to have had the highest proportion of COVID-19 infections occurring in healthcare workers.
Economic is too big to ignore. So when you have one healthcare worker that's infected or die, it's not just an extra COVID patient or COVID statistics. It really has a significant cost. So in this slide, we presented the cost per infected healthcare workers. And you can see it ranges from 10,000 per healthcare worker in Colombia to about 35,000 in Eswatini.
Healthcare workers at the forefront of the fight against the pandemic faced a higher risk of exposure and becoming ill. The report highlights that in many countries, health systems were not able to protect healthcare workers. The study found healthcare worker absenteeism due to COVID illness, isolation or death, and fear of being infected disrupts essential health service delivery.
Every healthcare worker that is harmed by a preventable infection is a tragedy, but also has an economic cost. On a practical level, they need to be protected. When healthcare workers fall ill because of lack of protections, the consequences go beyond that individual. This report shows it's expensive, but has long-term impacts across the health system and the community. An infected healthcare worker is at risk of infecting others in the health facility, in their home, and in the broader community. They're not able to provide other essential health services.
The study says COVID-19 infections and deaths among healthcare workers are likely to have longer-term impacts on the supply of the health workforce. It says COVID-19 surges tend to prompt healthcare workers to leave their jobs in clinical care, and training new health professionals will require more investment, driving the economic burden higher. It says young people who have witnessed the impact of diseases such as COVID may change their career choices. SABC News, Johannesburg.